I know one of those other concerns is, well, I'm getting it because I work at a healthcare system, but my loved ones don't and can't. Right. But their day is coming.
Right.
And what we want to tell them is that if they will go to c19vaccine.southalabama.edu, your loved ones can actually go on and register and schedule themselves, get registered for the vaccine. And once their category comes up in the queue, they'll be getting in touch with them and set up dates for them. We do the vaccines at the Civic Center in the arena. I've had mine. I'll share my vaccine story, then I'm going to share my pre-vaccine story with you. And I think it's important to get a real life story as you shared your trial story. I actually received my vaccine a week ago, my first one at the arena. I stayed in the car the whole time. It was nice and comfortable there, and pulled around to a waiting area, and they had a magnetic timer on there for 15 minutes, and you're not just sitting in your car long. Someone comes and checks on you actually during that time to make sure you're okay. And then I was on my way. That was Friday afternoon. On Saturday, I actually had chills and body aches and fever. I did after my first shot. But the reason I had those was because a month and a half before, I had COVID.
Okay.
And took all the precautions that we all take at work, and being extremely cautious. And I quite frankly thought that it was going to be 2 weeks. Well, don't have to come to work for a few days. I can get a lot done, still do my meetings.
Right.
It was a different story.
Okay.
Extreme fatigue was the big issue, body aches and fevers for several days. And in fact, the real fevers didn't start until the second week, when I thought I was getting ready to come back to work. Fortunately, it never got into my lungs, but I understood how serious it was, and I feel very fortunate that it didn't get any more severe.
Right.
But I was off the full 2 weeks because I needed to be, and I wasn't fully 100% for really another couple weeks after that. And we have those people out there now called the long haulers,
right,
who have these problems that continue to persist. So the shortness of breath, the weakness, the issues with brain fog.
Yes.
I had it during those 2 weeks.
Okay.
I didn't want to do anything that required any concentration. So because I had it, I had natural immunity. There had been a recommendation that you wait 90 days after the infection before you get vaccine. We now say that if you're asymptomatic and for 10 days, that it's safe to go ahead and do it. But yes, because my immune system had already recognized it, I did have that. But Tylenol dealt with the symptoms. The next day, I was fine.
That actually happens with the vaccine as well.
Mm-hmm.
I had minimal soreness, just mild soreness of my arm after the first vaccine. When I got the second vaccine, though, the next day, I felt tired, but that's the end of the work week, so I didn't necessarily blame the vaccine, but then I developed a fever. I was here and I said, it's hot in here, and everybody else said, no, it's not. And that's how I knew I had a fever, so a little low grade. And I had a few chills and body aches that day. The next day I was fine. So the fact that it happened after the second one sort of was reassuring to me that my immune system was reacting. And in the study, we were allowed to take Tylenol or ibuprofen if you wanted to, but since it was 99.8, I wanted to see if it would go up. So I didn't take anything, but I did have that effect afterwards. And there are other people who mentioned that as well.
Right, a number of folks have mentioned it, but again, it's usually short-lived.
Right.
You know it's working.
That's right.
All right. As you said, and we want to reiterate that the vaccine, though, is still, I call it number 4 piece of our protection.
Right.
We have social distancing, hand washing, masks, and we have a vaccine added to it.
Right.
And doing all those things
yes.
appears that it keeps you from getting really a clinical infection that you would recognize, clearly keeps people alive. And what we don't know is whether or not you can still get an infection and might still get the virus, harbor the virus, and be able to pass it on. That's why we still need to mask and
still
distance.
have to stay vigilant. But you know, another interesting thing is, you know, this time, you know, last year during flu season and RSV for children, our emergency room was packed. In fact, we had chairs out in the hallway. And we haven't seen that this year. So I think the things that we have done to try to keep COVID-19 at bay have worked for flu and RSV as well.
That's, and that shows that these are good public health habits to have. You know, I guess one of the last things I think to talk about is the fact that Operation Warp Speed was put together, sort of organized by the government. And there's clearly lots of people in this country who are distrustful of things associated with the government. Tuskegee was a trial supported by the government. But I think it's important to recognize that the development and the actual running of the trials might have been supervised by the government, but it was really this private industry who produced many of the drugs that people take on an everyday basis, who were the ones out front doing this work and did it through this entire time.
That's right.
Yeah.
That's right. And so we want to encourage people to be vigilant. We want you to keep up with your medications, your appointments. I know here at South we've done telehealth, we've done telemedicine, where through Zoom we've been able to see our patients and communicate so that they didn't have to come in at particular times. And you know, our patients have also been good about calling us in advance of their appointments to say, hey, I was exposed, or, you know, I have these symptoms, and so they know not to come to the clinic during that time. But we can't prevent everybody, you know, and everybody's not going to call in advance, but we have the screening procedure at the front door where we can try to pick up things that are going on. Fevers, they're screened with the temperature. A list of symptoms. Everybody that enters has to have on a face mask, except children younger than 2. It's not recommended for children younger than 2, or those who have conditions where if they were having breathing problems, they wouldn't be able to remove the mask. But we're taking the proper precautions and, you know, being safe. But if you just absolutely don't want to come in, then at least keep the line of communication open. The medications that are supposed to keep your conditions under control are of absolute importance, utmost importance. You can even talk about getting 30-day or 90-day prescriptions so that you're not going out to the pharmacy if that's the case.
That's right.
But we have to be vigilant.
Have to remain vigilant.
That's
and
right.
Just remember, for yourself and for your family and friends, go to c19vaccine.southalabama.edu. That's c19vaccine.southalabama.edu. It is no cost for the vaccine. It's important that the vaccine does not cost anyone. There will be an inquiry regarding insurance information, but there's no cost directly to anyone for the vaccine. We hope you all think really hard about getting it and participating in getting the vaccine. There will be opportunities to interact with healthcare professionals in South Alabama if there are future questions. And we hope that the discussion that we had today is something that answered your questions. If not, please get in touch with our people in marketing and with your direct supervisors, and they get the resources to you to answer your questions. Thank you.
Thank you.